Hello viewers, how are you? I hope you are all will be fine. Welcome to Radiology Forage. This video is created by Dr. Ali Hamza. In this video Dr. Ali Hamza will give a complete introduction about CT scan. If you are new on Radiology Forage, so please must like and share this video and subscribe Radiology Forage. And press the bell icon to get all notification about Radiology Forage. Now let's start knowledge full lecture about CT scan. The first CT scanner was built by Godfrey Hounsfield in 1971. It was designed to only take pictures of the brain, and revealed a brain tumor in a 41-year-old female patient. Tomographic techniques had been used since the 1930s, but Hounsfield was the first to combine an X-ray machine and a computer. In 1975 the first whole-body CT scanner was built. CT scanners are now used to take pictures of virtually any part of the body. CT scanning owed a lot to pop band The Beatles in the 1960s. Hounsfield worked for EMI, the company that owned the Beatles' music. EMI used the profits made from Beatles records to invest in Hounsfield's scanning technology. In 1979, Hounsfield was awarded a Nobel Prize for his work. A procedure that uses a computer linked to an X-ray machine to make a series of detailed pictures of areas inside the body. The pictures are taken from different angles and are used to create three-dimensional 3D views of tissues and organs. A computed tomography scan is a medical imaging technique used to obtain detailed internal images of the body. The personnel that perform CT scans are called radiographers or radiology technologists. An X-ray image made using a form of tomography in which a computer controls the motion of the X-ray source and detectors, processes the data, and produces the image. What is the basic principle of CT scan? CT is based on the fundamental principle that the density of the tissue passed by the X-ray beam can be measured from the calculation of the attenuation coefficient. Basic principle: CT scans are created using a series of X-rays, which are a form of radiation on the electromagnetic spectrum. The scanner emits X-rays towards the patient from a variety of angles, and the detectors in the scanner measure the difference between the X-rays that are absorbed by the body and X-rays that are transmitted through the body. This is called attenuation. The amount of attenuation is determined by the density of the image tissue, and they are individually assigned a Hounsfield unit or CT number. High-density tissue such as bone absorbs the radiation to a greater degree, and a reduced amount is detected by the scanner on the opposite side of the body. Low-density tissue such as the lungs absorbs the radiation to a lesser degree. Conventional X-rays provide the radiographer with a two-dimensional image and require the patient to be moved manually to image the same region from a different angle. In contrast, because of the advanced mathematical algorithms involved with CT, the three-dimensional planes of the human body can be imaged and displayed on a monitor as stacked images, detailing the entirety of the field of interest. This is accomplished by acquiring projections from different angles, and through a process known as reconstruction, the three-dimensional data is viewable on a two-dimensional monitor. The data collected can theoretically never be a perfect replica of what is being scanned, but is a close enough representation to be used for medical diagnostic purposes. What are the most common types of CT scans? Common types of CT: computed tomography, CT scan, Johns Hopkins Medicine. The most common type of CT scan with contrast is the double contrast study, which will require you to drink a contrast media before your exam begins in addition to the 4 contrast. The more contrast you are able to drink, the better the images are for the radiologist to visualize your digestive tract. Several types of low-dose CT scans are offered at Atlantic Medical Imaging in New Jersey, including CT scan abdomen, CT angiography, CT scan arthrography, CT scan bones, CT scan brain, CT scan head, CT scan chest, CT scan lung, CT scan neck, CT scan pelvis, CT scan renal stone, CT scan sinus, CT scan spine. Why contrast CT scan is done? Your doctor may recommend a CT scan with contrast to help diagnose muscle and bone disorders, such as bone tumors and fractures, pinpoint the location of a tumor, infection, or blood clot, guide procedures such as surgery, biopsy and radiation therapy, detect and monitor diseases and conditions such as cancer, heart disease, lung nodules and liver masses, monitor the effectiveness of certain treatments, such as cancer treatment, detect internal injuries and internal bleeding,